Hello and welcome back to the 5 Cent Cigar Newscast. I'm Leah Crowley. Thank you for joining us. Coming up this week, we have how businesses in the Emporium are surviving and whether nursing majors were tested before their clinicals. Plus, we have what you need to know about that upcoming Candlelight Vigil for Black Lives Lost to police brutality and more information on that potential campus curfew. Stay tuned. Small businesses have been hit hard by the pandemic. That includes those in the Emporium. Aniekan Okon has more.
The coronavirus has had a devastating effect on local businesses in Rhode Island and around the country. Currently, 13% of all Rhode Islanders are unemployed. I talked to local business owners to see how they're managing these difficult times.
For Cousins Bakery owner Luann Cox, COVID came at an unfortunate time.
We were open about a month and then the whole COVID thing hit.
Alyssa Shiano, who was less than a year into running the Rhode Island Yoga Center, also experienced a shift in plans.
The change, owning a whole yoga studio, and kind of looked ahead at what potential problems could come up. And never once did I think a pandemic would be one of the issues.
Shiano decided to close her yoga studio for 3 months to ride out the pandemic and allow for proper cleaning. Unfortunately, Cox didn't have the option to close her doors.
Some days I'd look out the window, there wouldn't be a soul out there. And then thankfully 2 or 3 people will call and say, can you make us a birthday cake?
To avoid shutting down for good, many small businesses have relied on government assistance.
Any loans were really just to keep the business going and anything that we needed to do to keep our teachers paid and keep the doors open, the lights on, and the rent paid.
Unfortunately, Cox's business type caused some issues.
I'm an LLC, sole proprietor, and so I haven't been able to get any of those funds that small businesses have gotten.
While Cox worked to make ends meet, the Rhode Island Yoga Center put together virtual classes on Zoom. According to Shiano, these classes allowed her clients to de-stress during these difficult times.
It was like this little bit of time to come together in a sense, even though we weren't physically together, we were seeing each other and catching up and practice together and just take that hour or more to all be doing something at the same time and feel some semblance of normalcy.
The two do hold hope that normalcy will return sooner rather than later.
I am truly hopeful that we'll be allowed to and able to safely get back to a place where all the businesses in Rhode Island are able to get back to some semblance of normalcy.
Getting through 1 year was one thing. I don't know if I can take another hit like last year.
With the winter months coming, these businesses will need your support more than ever. Reporting outside of the Kingston Emporium, I'm Aniekan Okon, 5 Cent Cigar News.
Concerns have risen over whether nursing clinicals should move online due to a number of cases in the program. Evan McAlice has the story.
Every URI nursing student must complete clinicals at various healthcare facilities where they shadow nurses and RNs on the floor. But due to concerns over the ongoing coronavirus pandemic, the School of Nursing has placed a number of safety measures to ensure the health of students remains intact while also giving them the education they deserve. What safety precautions is the nursing department taking to keep students and faculty safe during this current health crisis? I spoke with a nursing student to find out more.
Hello?
Hi, Pratita.
Pratita Chia is a junior nursing student completing her clinical at Rhode Island Hospital in Providence.
We take vital signs, give the patients bed baths. We're on the neuro-stroke unit, so they all have neurological problems, so we have to assess those. We've only been there for a couple weeks, so hopefully we'll get to do more stuff in the near future.
This is Chia's second clinical semester at URI. Her first clinical semester was cut short and moved online due to the pandemic. Now, back in person, clinicals have taken a number of precautions to ensure the safety of students and patients.
Obviously, we're all wearing masks and trying to be safe. They have limited the amount of students. We all did get tested for COVID, working with patients on precautions. At first, I don't know if all hospitals were requiring it. So last week, we actually all had to take clinical off and do a virtual clinical.
In a statement released by the University of Rhode Island, clinical students are required to follow strict screening and surveillance testing procedures, mandated last month by the Rhode Island Department of Health. While these measures are in place, numerous reports of positive cases among clinical students have put the semester at risk.
I know a couple people in sororities have been maybe around people, and I think they might be in contact with the instructor running all the clinicals, and I think it's been arranged for them to do virtual clinical until further notice.
As the number of positive cases at URI continues to rise, the threat of another online semester looms nearer. And while student and patient safety is top priority, Chia worries about a transition back to virtual clinicals.
It just feels like a lot of busy work when we have to be doing things and staring at a computer for a long period of time when we could be, in person, working with real patients.
According to the statement released by the university, students are closely supervised by faculty through their clinical experience, given skills training regarding safety and infection control, and they are well versed in appropriate use of safety equipment. While the future is uncertain, Chia believes that the nursing department is doing everything they can to keep students safe.
I think we're doing everything we can. Everyone's getting tested. Everyone's putting on their mask and wearing the right precautions. I think everyone's doing their part right now.
The university plans to continue monitoring students in clinical settings to minimize potential risk. This includes proper preparation and training, symptomatic and asymptomatic surveillance testing, and quarantining if necessary. Reporting from outside of Whitehall, I'm Evan McAlice, 5 Cent Cigar News.
A candlelight vigil for Black Lives Lost to police brutality is scheduled for Sunday, October 18th at 5 p.m. I sat down with Black Student Union President Leah Crowley. Here's what you need to know.
We thought it was best to have a candlelight vigil as a way to have people come together, and instead of having an environment that's, full of anger, although it's going to be full of anger, have a time for us to come together and kind of mourn in a healthy way all the lives that were lost.
The vigil will be taking place outside of the Multicultural Student Service Center.
We're going to have speakers. We're going to have memorials of, I believe, 30 lives lost, 30 to 35 lives, particularly pertaining to the lives lost in 2020, and then obviously the monument lives that started the Black Lives Matter movement, like Trayvon Martin, Mike Brown, Eric Garner, but then we'll have the current lives like Breonna Taylor and George Floyd and Ahmaud Arbery.
BSU has 100 candles to be provided, but attendees can bring their own candles, flowers, or artwork.
It's welcome to all multicultural communities, allies of multicultural communities, students, staff, faculty, administration, and we are going to enforce social distancing. Masks are required. We want this to be a beautiful event, but at the same time safe.
BSU is also holding weekly conversations on Tuesdays at 7:30.
And I think that right now, definitely students of color are ready to take a stand with events like this and lectures like this to kind of let them know that, we do matter, and on this campus at a predominantly white institution, the last thing that we want to do is feel like we're unheard. So I'm very proud of the BSU and the things that we have planned, and all the other multicultural orgs, and what they're doing right now is really, I feel like it's really like a critical component to the growth of our university as a whole and where we are right now. If you are someone that is on the fence as far as like, oh, am I an ally to this community? Am I not an ally? We want you to come, and we want to welcome you into our community as a way to like educate you. But yeah, I definitely would recommend anyone come if they're willing to listen, understand, and acknowledge what the Black community is dealing with right now.
And now Nicole Wagner has updates on the potential campus curfew and more.
While the Greek life community remains under the university's shelter-in-place order, a widespread on-campus curfew has not been implemented, but is under consideration.
There's no curfew being implemented. What we are discussing is the potential value of a curfew.
The decision point on whether or not this curfew is implemented depends on the results of the mandatory baseline testing at URI. President Dooley said that 1,600 students will be tested per day. However, Dr. Christopher Nazen said the results have shown that a majority of the positive COVID-19 cases in the community have been found in off-campus students.
They really thought that without mandatory testing of essentially the whole population, it's going to be really hard to extinguish that outbreak off campus.
The mandate from the Rhode Island Department of Health that URI implement this baseline testing is fundamental in controlling the spread of the virus.
What I've seen anecdotally is a lot of our students are in small social gatherings and they kind of feel like, well, if it's less than 15, we should be good. But, that's not always the case, right? And we've seen a bunch of cases transmitted that way.
Dr. Deborah Burks commended the ability of student leaders to mobilize their community during her visit on October 9th.
The student government leadership and frankly many of the Greek leaders have been really critical peer-to-peer leaders, and that's how messages are often best conveyed.
After finding that students in Greek life had such a high positivity rate, the university called on the Greek life community to help stop the spread of the coronavirus.
According to URI's tracker, for the week of October 4th through the 10th, there have been 154 positive cases with a positive test rate of 2%. That's all we have for you today at the 5 Cent Cigar Newscast. Stay safe, Rhodey.